Do you have a child or know of an adolescent athlete who's looking to compete at sport at a good level, doing lots of volume and ultimately getting better? Well, then I have 4 checks that I want you to take on that child to make sure that they are not putting themselves at any increased risk of injury. So stay tuned. Firstly, thanks for checking out the channel. My name's John, I'm a sports injury therapist, and I want to do 3 simple things. Help you to understand your body better in order so that you can strive forward and hit your health and well-being goals free from pain. But in this one, it's a slightly different one because I want to talk about how you can help others. In our clinics, I talk to many parents whose children are looking to make their way through their sporting journeys, and they obviously want to do more and more and more. As they increase their level of activity, unfortunately, this increases the chance of injury. So in this video, I want to go through 4 simple checks that you can place upon your child or loved one, or you may run a sports team with lots of athletes in it, that you can look to be making sure you can perform this screen to see if they are at increased risk of injury. And the good thing about this is hopefully we can catch injury before it happens. You can give them tips on how they can improve this so that they can make sure that they're not suffering further down the line. So really this comes about by flexibility. And what we're looking to do is address 4 key areas in the youth athlete. That's the flexibility of the glutes, the flexibility of the quads, the flexibility of the hamstrings, and the flexibility of the calf complex. And the good thing is we can check this really simply. But these are common conditions or common areas that cause some of the common growth-related conditions. Conditions such as Osgood-Schlatter's disease and Sever's disease are very common in the youth athlete. And you'll find on my channel lots of videos about this. But these are my 4 quick tips so that you can perform this screen to make sure that your child, your loved one, your team are not at risk of these injuries. So firstly, the glutes. In order to check your glutes, you want to ask the child to lay flat on their back. What we then do is bend one leg. This is the side that we are, this isn't the side, sorry, that we are testing. With the foot that we are testing, you then place that onto the knee. With that leg, we then lift that up. Now, what we've got here, I call this the figure 4 test. What we want to be able to achieve is that the lifting leg can take the foot or the side that's being tested to 90 degrees. If you find that the child can't reach that, that is then showing us that there's a tightness in that glute. If they complain of a pain or a real intense pulling sensation around the hip, this is an indicator that it might be a little tight in the area. And the good thing is, with any of these tests, if the test is difficult, then that becomes the stretch. This is something that they can implement daily in order to get rid of that pain or that issue. The next one we want to address is the quads, a real common one because these muscles cross the front of the knee. Some of the conditions like Osgood-Schlatter's disease typically caused by tightness in the quads. Ask the child to lay flat on their front. All we want to get them to do here is to pull their foot up towards the bottom. We want to make sure that their hips are nice and flat on the floor and they're not rocking from one side to the other, but they should be able to grab that ankle and pull that foot in so it touches the bottom. Again, now feel a pull through the front of the thigh, but if they can't do this, if they find that they can't grab their ankle or they can't get that ankle to touch the bottom, that's an indicator that we're tight in this area. And like before, that becomes the stretch that you want to recommend they do daily for 30 seconds every day in order to make some improvements. Next up, we want to be working the hamstring area. So for our hamstrings, we want to lay flat on the floor, looking up to the sky, what we call a supine position. We want to keep our hips nice and flat on that floor at all times, and the leg that's not being tested. With the leg that is being tested, we want to lift that leg up towards the sky. The key thing here is we need to keep the knee straight. Lots of children will look to cheat and bend that knee because that's going to take the hamstrings off a stretch. But we need that leg to be straight. And what we should achieve is that the child can take that leg to 90 degrees, straight up in the air if you like. If they can't, if they feel this big pull in the back of their leg, or we might typically see the leg start to shake, or they're finding it difficult, that shows us that we have a tightness in the hamstring. And this is the stretch that you should be recommending that they do at least once a day, holding it for 30 seconds. Now, finally, to test the calf complex, what we would typically do here is do a knee to wall test. So what you want to do is ask the child to come and stand by a wall. We talk about utilizing a fist difference. So what we look to do here is place the fist up against the wall, and then the toe should go behind that fist. Ideally, we're looking for about 10 centimeters of range. So if you've got a tape measure, even better, they should be looking to be about 10 centimeters away from the wall. But actually, a fist difference works. An adult fist difference can be about 10 centimeters. The key thing here is that the heel stays flat on the floor. And what they should be able to do is drive the knee over the top of the toe, keeping the hips nice and level and square to the wall so that the knee touches the wall. Typical things that might happen is they might have to start to lift their heel in order to do it because the knee can't go far enough, or they might start to twist their hips to take themselves towards the wall in order to help. Both these things are showing us that they're not quite flexible enough in that calf area. And what we want to be doing here is utilizing something like a calf stretch that you can see here. So slight different to the test on this one, where we're looking to hold that position for 30 seconds. Again, done daily to improve that. And there we have it. There's 4 tests that can give you that screen of a youth athlete. And what I would recommend if you find the child to be tight in an area is explain why they're feeling tight, that they have a lack of flexibility in the area. Recommend that they do the stretch at least once a day, every day. But the good thing about youth athletes is they respond really well. If they can keep this up for a week to 2 to 3 weeks and then ask them to retest, they will get much improved results in my clinical experience. So I hope that's been helpful. If it's been helpful and you've made it this far through the video, smash that like button because that's going to help others to see this. And if you haven't subscribed to the channel, make sure you hit that subscribe button so you can join our community and I can take you on this health and well-being journey that we're all on. And I'm going to look forward to seeing you on the next video, and here's another one to help you on that journey. See you on the next one.